So what have we seen so far? We've seen a lot of theory. And so what we want to know is, does it really happen in real life? Can we take these ideas and take this principle and apply it to people? And so let's just look at some children, some pediatric cases just to begin with, because we know that children are going through active growth and development. And the idea is, can we harness that growth and development as the development proceeds? And the short answer is, I think we can. So here's a young child, and what we can see, these are baby teeth. And what we see in these baby teeth is that there's a crossbite on this side here. And a crossbite means that the teeth are not biting in the normal relationship. And so what that tells us is that this top jaw is not wide enough, okay? Because if the jaw was wide enough, those teeth would be over the bite on this side here instead of being inside the bite like they are here. Now, this is a child who's about 5.5 years old, not even 6 years old yet, so it's a young child. And by wearing the appliance for about 3 months, okay, what we can see is the top teeth, the permanent teeth, have come through, and that this bite relationship has been corrected. Now, what's the big deal here? Well, I guess the deal is that this was done completely without braces, and also it was completely pain-free. This child wore the appliance in the late afternoon, in the early evening, and at nighttime when they're sleeping, but not during the day. And so it's a procedure which is comfortable for the children, and no one needs to know that you have this appliance in the mouth. And what we see here is a little bit of spacing. Well, that spacing is a good thing, because what we know is that when you have baby teeth in this position, biomechanical, we should start getting spacing here before the permanent teeth come in, because the adult teeth are larger than the baby teeth. And so if you don't have spaces, like here there's not a lot of space here, if you don't have spaces in the deciduous or the baby teeth and the milk teeth, it means that the jaw is too small, and it means that the adult teeth are going to be crowded, they're going to be irregular when they come through. And we see here spacing appearing, okay, so this is a biomimetic approach. Is there any further evidence to say that this is a biomimetic approach? Let's look at this child, and here she is. And this is what she looked like before the treatment was done. And she's a cute-looking kid, and you're thinking this is totally fine, which it is. But what we do see is there's a bit of a head rotation. The head is kind of rotated, kind of in a counter or anti-clockwise direction. And then look at her shoulder here and her shoulder here. This is before she had the treatment. And here she is 3 months later. Her head seems to be slightly more straight. And if you ask me, those shoulders are kind of more level than they were originally. Remember, we talked about a top-down procedure. We get the top jaw corrected, we get the bottom jaw corrected, and therefore that change should go all the way down, right down to the feet of that particular patient. Now, we're not going to be looking at feet today, but I can tell you that we have done studies to show that the leg length in people becomes more equalized when they have the appliance therapy done as well. So that was an example of a younger patient. And you could say, she was going to grow and develop that way anyway, so maybe it's not a good case. So let's look at a slightly older patient. Here's a young guy, and his chief complaint, the parents said, look, his gums are too, excessive when he smiles here. And so they take him to our friendly orthodontist, and he actually, put the braces on like they typically do. But the gummy smile didn't go away. And so the parents said, is there something else we could do? And we worked closely with the orthodontist saying, let's do a little experiment here to say, what would happen if we took the braces off and put the DNA appliance there, and let's just try to see what happens. If it doesn't work, we put the braces back on. Well, what happened in a period of about a month is that the gummy smile became resolved. And what that means is it's not so much about straightening the teeth, but the underlying bone here has been remodeled, and so the gums are now kind of hiding behind the upper lip when he smiles instead of being excessive, and that allows the bottom jaw to come further forwards, and so he gets a slightly better facial profile. Now, you could say, well, you got lucky on that first case, and he was going to grow that way anyway, So let's do another case. And so here's another young guy, independently done, no history of braces. But again, the major concern of the parents was that he's got the kind of smile, and when he smiles, he's got kind of a lot of gum tissue showing. And so, again, we used a lower appliance, an upper appliance, should I say, in this child, and he wore it for about 4 weeks. And what the parents said is when he came back, what we found is that the gummy smile has been reduced. When he's smiling, he's not showing so much gum tissue, and the lower jaw is starting to come forward. So we see it, from time to time that we can reduce these gummy smiles in patients who don't like that type of appearance. Here's a different case, and in this case, the major concern was that the teeth were crooked. And again, this is a younger child, and the main concern here was that there may be insufficient space, and so the parents' fear was that teeth might be taken out whilst this patient is, getting typical orthodontic treatment. So the option that was put forward was, well, let's see if we can redevelop that jaw using an upper appliance to see if we can straighten those teeth out without braces and wearing the appliance late afternoon, early evening, and all night. So no one needs to know that this child is having treatment done. The child will finish school, puts the appliance in, wears it in the afternoon and the early evening, takes the appliance out when they're having their evening meal, brushes the teeth, cleans the appliance, puts it back in, wears it all night long. So 12, 14, 16 hours of wear, one for the top and one for the bottom jaw. In the period of about 2 years, you can see that those teeth are pretty much straightened out and no braces were worn. No one needed to know that that child was wearing an appliance to have the teeth straightened out. And, of course, what we want to encourage is a tongue. You see, the tongue is down here between the teeth, and it's kind of further back here. We encourage the tongue to be sitting up on the palate here, and that will prevent any relapse from occurring. It'll prevent the teeth from moving back at a later point. So let's go to a teenager now. So we're going from younger children. These patients are getting older and older. And here was a young young lady, and she didn't have a very broad smile, and she was kind of concerned about her kind of appearance here. And so she started with the appliance, and what we found is that the bone kind of tissue here became remodeled, the teeth became slightly more straighter, and her lip volume also started to improve. And so if you look at her teeth before the treatment was done, she had this kind of deep bite where the top teeth are almost covering the bottom teeth. And she wore the top appliance to redevelop the upper jaw here, allowed the bottom jaw to come forward. And you can see that the teeth are biting much more evenly now. You've got more tooth show on the lower arch here on the bottom teeth, and that she has a nicer looking facial profile. And so the other thing we found is that the amount of jaw opening, because if the jaw is being held back, then the mouth opening is reduced. And if you allow the bottom jaw to come further forward, the mouth opening can be improved and increased. And actually what we need is about 48 or maybe 50 millimeters of opening of the mouth. We can measure that. And what we found in this case is that the amount of mouth opening improved as that bottom jaw came forwards. And it came forwards because the upper jaw was redeveloped, so there was a new functional space, a new space for the bottom jaw to move into to allow this correction to occur. And you can see the top jaw is looking quite nice, and in terms of the tooth alignment, the bottom jaw is looking quite nice. These teeth on the right and left side are kind of meeting as you'd expect them to do so. And from the front, it doesn't look too bad. And all of this was achieved without using any braces. And this patient was wearing the appliance late afternoon after school, in the early evening, and then all night when she's sleeping. She did not wear the appliance during the day. It's called a DNA appliance. DNA stands for daytime, nighttime appliance. You do not wear the appliance during the day. You wear it late afternoon, early evening, and all night. And here she is again. It's the patient that we saw with that kind of jaw, which is kind of too far back. By developing the top jaw, you can see the amount of bone development that's happened here. The lower jaw has come forwards. It's meeting the top teeth very nicely and producing a nice-looking lower facial profile. So those were mostly young children and teenagers. Well, what about adults? Does the same principle apply in adults? Can we get those genes to work for adult cases the way we do for children and for teenagers? Well, let's have a look. Here's a young lady here, and this is treated by Dr. John Caulfield, and he's in Colorado. And one of the things that she was concerned about was the fact that, again, she has this gummy smile, a bit like those younger children that we saw earlier on. And she's been wearing the appliance, in the afternoon and in the evening, and at nighttime when she's sleeping, but not during the day. And in a period of about 6 months, you can see that her facial profile has improved. The gummy smile has kind of gone away. And this is due to the remodeling of the bone. Again, no braces were used. And you see her facial profile, her chin seems to be set a little bit further back. And about 6 months later, you see her, and that jaw is starting to come further forwards. You get a slightly improved facial profile. She's looking better, she's sleeping better, and it's just a nice-looking patient. And what we know for adult patients who sleep better is that they get improved systemic health. And so things like complexion are improved, vitality, awareness during the day is improved. So there's a lot of things to be said about getting a good night's sleep, particularly in adult patients. And so by wearing the appliance at nighttime, not only is it doing the bone remodeling and the tooth repositioning, but also allowing restful sleep and giving that replenishment that the brain needs to have improved activity during the following day. So let's go back here. Here's another patient that came to the dental office, and her main concern again was this kind of gummy smile and the fact that her front teeth don't meet. When she chews or bites together, the front teeth there's a space between them. So let's have a look at a close-up of those teeth. Here we see the space between her front teeth, and there we see a lot of gum tissue when she smiled. And here's the same patient again. So she went for a review, and what she was told was that the only way that she could be helped was to have surgery done on her top jaw and on her bottom jaw. So she wasn't very keen on that idea. And so she started to research and find out, is there any alternatives that could be used instead of using a surgical option? So we said, well, let's try a DNA appliance and see what happens. And so she starts wearing the top appliance, and this is after about 2 months of treatment. And what we can see is after 2 or 3 months that the top jaw has been remodeled. The bone has started to change. It's got a little bit wider, and that gummy smile has started to be reduced. Now, what we see is the space between the teeth is still there, so treatment's not finished. She now needs to go to a bottom appliance, a lower appliance, to make sure that both the top jaw and the bottom jaw are coordinated. And that whole procedure took about 14 months, took close to 14 months. But what you can see at the end is the gummy smile has gone away, the bone's been reshaped and remodeled, and the open bite that she had has been also reduced. And in this case, we used final brackets, orthodontic brackets at the end. We used just to make sure we've got a lot of coupling of these top teeth to the bottom teeth, just to make sure that the whole result is stable. So in this case, she was finished off using brackets, but the amount of bracket use was very minimal at the end, just to get to that final detailing. But look at the changes that happened. So all of this was achieved with a DNA appliance. Look at her nostril on her left side here, the right side in the picture. It's pretty much blocked, it's closed, which means she was opening her mouth to breathe, which is probably why she got this gummy smile and this open bite. And then by widening her upper arch, her top jaw, using the DNA appliance, you can see that her nostril here is symmetrical. So now she can breathe through her nose more easily. That allows her to keep her lips together. And after about 14 months, combination, mostly DNA, a little bit of detailing with the orthodontic brackets at the end, and she has a nice-looking smile, no gummy smile, and no anterior open bite, and she's breathing and sleeping really well. So what do we say? How do you describe this in terms of scientific words? Well, this is a correlation between the form and the function. The form is the shape and the size of the jaws, and the function that we mentioned, breathing through the nose, sleeping well, swallowing with the tongue going back. So all of this supports the idea of craniofacial homeostasis, that this whole craniofacial region has reached a new level of equilibrium, a new level of harmony, and it looks nicer and it works better. So again, you might say, well, you picked out the best case there. Let's take a different case, again, treated by a different dentist. And here was Dr. Sam Kress in this case. If I just go back one slide, the previous case was treated by Dr. Bill Harris. And here's a different patient, a different dentist. But the idea is we want cosmetic treatment with health benefits, the same idea. And so this young lady's been going to the dentist on a regular basis. And, she says that I'd like to have a little bit of facial enhancement. My lips are a little bit thin here. Is there anything I can do without having to do Botox or without having cosmetic surgery? And so what we said in this case is let's try the DNA appliance and see what happens. So she starts wearing the appliance for the first 3 months, and she noticed some changes. And then after about 6 months, she noticed some changes. And after about 12 months, she feels that her facial appearance has been enhanced. Her complexion has improved, her lip posture has improved, she's sleeping better, and she's feeling better as a patient. Now, this young lady happens to be a medical rep who works for a pharmaceutical company, and, she was having dinner with one of the local plastic surgeons, and he was saying, well, did you have some Botox or did you have some fillers done? And saying, no, all of this stuff was done by using an appliance, and I wear it at nighttime when I'm sleeping, and it's a thing called a DNA appliance. So let's see what happened when she wore that appliance. So look at her top jaw. You see the top teeth here that are a little bit out of alignment, and you see that the top jaw is a little bit narrow. It's got a high vault. And then after about 12 months, you see this nice-looking arch. The teeth are improved in terms of alignment. The arch is a little bit broader, it's a bit flatter, and it gives her more space to accommodate her tongue. But let's look at her lower jaw, her bottom jaw. You see the teeth are a little bit crooked to begin with. And after about 12 months, she wore a lower DNA appliance, no braces, no brackets, and those teeth are straightened down. But the interesting thing is what her tongue did. You see the tongue here is asymmetric, it's lying further back. And now the tongue is more symmetric, and it's lying a little bit further forwards. And so this is what we mean by the functional correction, is that we're going to improve the architecture of the bones and the teeth, but then we want the soft tissues, the tongue especially, and the lips, to perform and to function better. And when the tongue comes forwards, it allows the airway space behind it to be opened up. Now, let's just see what happened in 3D. This is a 3D bone scan. And what we did is 2 scans. The gray scan is before treatment, and the blue scan is after treatment. And then what we did was superimpose the 2 scans to see, was it the same or did something change? And what we see here, the top jaw and the teeth are blue here, and the bottom jaw and the teeth are blue here. So most of the changes happened on the right side. And if you look at her face, you look at the nostril here, it's the right side which needs to be kind of further developed. And so the body was able to make new bone volume on the right side here, which allowed those teeth to come into that new position. And when the upper jaw was remodeled, the lower jaw was be able to move the lower jaw into this position here, so it looks as if it's further forwards. The teeth came with that lower jaw, so they're further forwards. And the teeth on this side, they have changed their position to give a more symmetrical smile. Now let's look at her airway. This is the same patient. Now this is a 3D reconstruction of that patient's upper airway. Here's the top of the airway going down towards her throat region here. And if we see her airway before treatment, we see it's kind of narrow, kind of behind the tongue, behind the soft palate. This would be the region of the airway behind the mouth. We can see it's kind of narrow. And then after the treatment's been finished, the upper airway volume has been increased from about 17 cc's to about 28 cc's. We can measure it, and we can see that there's a tangible difference. It's broader here than it is here. And so now we know why she is sleeping better, because when the bone was being remodeled, when the teeth were being repositioned, the soft tissue became more symmetrical. We saw that on her face, but also the upper airway was improving inside of her throat. And this was done with no drugs, no injections, no pain, and without any surgery. So we call this thing a pneumopedic effect. There's no big word. And so pneumopedics, where does that come from? Well, orthodontics is straightening teeth, orthopedics is remodeling bone, and pneumopedics is remodeling the airway. And so here's a natural process encoded by genes. And so what we think is that the appliance is able to talk to those genes saying, keep on making a new airway because they've got more space because the jaws are getting bigger now. The teeth can be realigned, and that space is being occupied by this airway. So another case here, and let's just look at the progress of this case treated by Dr. Dennis Allman. Now, this patient also presented in the dental office, and the chief concern here was sleep apnea and snoring. And we can see that these teeth, if you count the teeth, we can see that there was a tooth missing here and a tooth missing here. This is a patient who had orthodontic treatment when she was a teenager, and in this case, the teeth have moved back to their kind of positions, but also the teeth that were extracted, the premolar teeth that were extracted here, that space has been lost. So she starts wearing the appliance for a few months, and we start to see a little bit of change. There's no space here, a little bit of space beginning to reappear in these regions here. And then she's wearing the appliance now for a few more months. You remember, the little space here is starting to increase, it's starting to get bigger. See it on both sides. And then after about a few more months again, that space is increasing again. So this is where she originally started, and this is how much space has been captured after about 18 months or so. So what is it telling us? What it's telling us is that the body has that template. That template is encoded by genes. And so in this example here, the jaw was small, the teeth were taken out, but if we talk to those genes saying, can you get the jawbone to regrow here, that's what's happened. And so we've got more space here to try to accommodate the teeth that were taken out, and eventually we'll get these teeth straightened out as well. You can see they're starting to move into the right position. It takes time. So this is an adult patient, approximately mid-40s, that kind of age. And so what we're able to show here is it's still possible to regrow bone in these adult patients, and that will allow the teeth to be accommodated without having to take these teeth out. And here's the same patient here. You see she had a very deep bite when she started her treatment, and about 14 months' time, the bite is starting to open up, the upper jaw is getting nice and wide, and the lower jaw will eventually catch up. So there's some way to go still, but she's showing remarkable improvements for middle-aged adults. And look at her facial features. The face kind of looks a little bit sunken in here. There's grooves look a bit deep. The lips look sunken in. And she looks younger here than she does here, in my opinion. And she's a happier and healthier patient. You see her jawline is starting to improve here. We start the jaw profile is starting to emerge. The lips are becoming fuller. And look at her smile. Can you see these big spaces here? She's got a broad smile, and she's a happier, healthier patient getting towards the end of her treatment than she was at the very beginning. Now, here's another example here, another younger, older adult. Now, his main concern was that he was waking up during the night. He didn't wake up. When he woke up in the morning, he didn't feel refreshed. And if you look at his profile, we see that the jaw is kind of like pushed back a bit, and he has this kind of double chin appearance. And then he's going to wear the appliance at nighttime. He's starting to lose weight. He reports losing about 25, 35 pounds of weight without changing his diet, without doing anything else, just sleeping better. And that bottom jaw is starting to come further forwards, and eventually we'll have him to the point where he will not need to wear the appliance. And it will take some time, but the point is that he's moving in the right direction. So here's a finished case. This is a published case. This is a 38-year-old adult male diagnosed with sleep apnea. We can see his top jaw where teeth were taken out when he was a teenager. And in about 10 months, we were able to recapture some of that bone volume. We increased the bone width to about 39 millimeters, used to be 34. So that bone is regrowing, it's redeveloping. Here he is before he started treatment, and here he is at the end. The spaces between the teeth have been covered with veneers. And we look at his airway before treatment. It's a 3D scan, using a cone beam 3D CAT scan. And what we see is that the airway before treatment is starting to improve after about 15 months. Here's the same patient. We reconstructed his airway in 3D. We can see it got a lot bigger. Looking from the front, we can see that the airway was constricted and narrow. And then after treatment, it's broader, it's wider. And if we do a sleep test on this patient, before treatment, he had moderate sleep apnea. He had 24 events each hour. Then after treatment, about 10 months later, it's less than 5, it's about 3, and that means that he no longer has sleep apnea. And we know this because we can reconstruct the airway in 3D. We can measure the bone volume, the airway volume, and what we find in these patients is the airway volume increases, and as the airway volume increases, that allows the sleep apnea to decrease, and in most cases it actually goes away. And that change is measured without wearing an appliance at the end of treatment. So it's kind of interesting that we start wearing an appliance, we get the development to proceed, and by the end of treatment, we want to get to the stage, ideally, where you no longer need to wear the appliance. Now, we still recommend wearing the appliance because we know that people undergo aging as they get older, and so you can wear the device as an anti-aging, with an anti-aging effect over a longer period of time. So that's the same patient, and his teeth have been crowned, or veneers have been added at the end to cover up the spaces. But, he doesn't look too bad. Look at his head posture. See his head is kind of tilted backwards here, and it's straightening up. His facial features have improved, and here's a healthier and happier guy. And this is what we mean by enhanced craniofacial homeostasis. So this is getting towards the end of the presentation here. Here's another young man, came in for treatment and wasn't very happy, wasn't sleeping well, didn't feel refreshed in the mornings. And we look inside his mouth, and what we see is a big bone spur on his bottom jaw on both sides. And we see that the teeth are really worn away, and we see the tongue is sitting in the back of the throat. Well, this type of bone deformity, if I can use that word, is not normal, and so we decided to remove this bone using a surgical procedure. So we asked one of our oral surgeon friends to remove that bone because it's just getting in the way and it's taking up valuable space. Well, what was the value of that procedure? We look at his sleep index before the treatment. It was like 21, which is mild to moderate sleep apnea. Then after this bone was removed using a surgical procedure, the sleep apnea went down by about 15%, and his oxygen saturation went up by about 30%, which is not a bad finding, but it's still not so good. The teeth are still worn away here, and he's still got sleep apnea. This is kind of mild sleep apnea. Now, what we did in the next stage was to say, well, those teeth are worn down, so let's rebuild up the teeth. So the teeth have been built up, and the teeth look nicer now. And here is a test that we did after the teeth have been built up. Now, look at the sleep apnea. Originally it was 21. After the surgery, it came down to 18. And after the teeth were built up, it came down to about 15. So he's still got mild to moderate sleep apnea. But look at the oxygen saturation. It's improving. So even though he's not better at this stage, we said, let's put in a DNA appliance and see what happens. And with the DNA appliance in place, the sleep apnea went from 21 down to 8. That's a 60% increase or improvement in sleep apnea. And the oxygen saturation has improved by 86.5%. So it's not just about the teeth and the bone, but there's some remodeling of the airway that goes on. That's why we use the appliance, and that can help to resolve sleep apnea in most cases. And what we have here is a healthier, happier patient. He's happy with the way he looks. He's happy with the way that he's sleeping at night, and we have improved form and function for this young guy.